Welcome to Modern Mindset, the show that picks the brains of the world's leading minds to help you unlock yours. Decoding the beliefs and strategies of global experts to give you an updated mindset to make the most of modern life.
This is Modern Mindset, the show that picks the brains of the world's leading minds to help you unlock yours. My name is Rory McGowan, and following Mental Health Awareness Week, I'm joined by Katie Modoc, someone who was diagnosed with bipolar type 2 disorder in 2014, as well as a senior consultant psychiatrist to talk about her journey in medicating her condition and the role that non-invasive treatments have for conditions like anxiety and depression here in the UK. I'm joined by Katie and Dr. Nikila Deshpande, a senior consultant psychiatrist and the founder of Tranquil TMS. Katie, Dr. Nikila, it's nice to have you both on.
Lovely to be here, thank you.
Good to be here.
So, Katie, I'd love to start with your story here today because during Mental Health Awareness Week last week, we've heard a lot of different stories about people's struggles to kind of come to terms with their own. Everybody has their own kind of story when it comes to mental health, so I'd love to hear yours.
So I became unwell at the beginning of 2013. I was in quite a responsible job, 2 young children, and I became ill. And by that, I mean, I had 3 months of basically clinical depression, followed by 3 months where I thought I was having a great life. Everyone else was quite like, what's going on? Because I was very energetic, very sociable. And that pattern repeated. And then by sort of September 2014, having already been put on a couple of medications and trying a few things which weren't working that well, I was actually diagnosed with bipolar type 2, like you say. Medications over the next 9 years worked to some extent. My lifestyle was improved a lot. So I was able to have, say, 6 to 8 weeks of feeling well, but then I'd have a couple of weeks where maybe couldn't get out of bed, definitely couldn't get out of the house. And as you can imagine, with 2 young children, that was difficult. Oh, and just to mention, in 2014, I lost my job due to my health. I don't think that would happen these days. I think there are more measures in place. So 2023 in the autumn, I had what I would call a crisis, kind of triggered a bit by my mental health, if that makes sense. And my psychiatrist, who had seen all this period, and I were like, right, we need to look for something. So we thought about NHS alternatives locally, but they weren't really suitable and going to take goodness knows how long to access. So we thought about TMS, and locally, Tranquil was the nearest, but also had the best reputation, the most information about what it involved, and went there for the 4 weeks sort of initial treatment. And after that, my life has revolutionized, basically. After the initial treatment, which spanned sort of Christmas 23, 24, I took a year or so just to reset. Then I did some work on a sort of temporary ad hoc basis. And I'm really pleased to say that now I've actually got a permanent contract again, which since the kind of difficulties in 2023, I haven't had. My life, I've got a partner again. My marriage had come to an end in 2015. Like I say, I've got the work. The children, they're older, but I'm more present as a parent. And it really has revolutionized. I've said that word before, but it has revolutionized my life because I feel like for my normal, I'm living that life now.
No, well, thank you for sharing your story, Katie. And you do seem a lot happier. Wow. Yeah, no, that is very powerful. We'll come on to TMS in a little bit when we speak to Nikila, but something that I think a lot of people who are on a kind of mental health journey, if they need to seek medication, will relate to your story of taking kind of 9 years plus to find the right thing for them. Can you speak a little bit more about that journey? Any tips of sticking with it, because finding the right thing always takes a long time, right? And kind of any reassurances you can give to those people.
As I say, those 9 years, life was much better than the 2013-14 period, where bipolar presents itself so differently for everybody. But I had, like, as I say, 3 months up, 3 months down, 3 months up, 3 months down. So even getting to the fact where a week or 2 weeks were taken out every couple of months was amazing. But in terms of taking the medication, one thing I hear a lot, and I've heard a lot from doctors and psychiatrists and people I've been in touch with over the years, taking it regularly. I know it's really hard for people, but a lot of people, apparently, I've never done this. I think it's just I'm a goody two shoes. I don't know. But a lot of people feel better and then think, oh, I'm okay. I'll come off the medication. And despite the treatment with TMS, I still am on some medication. But over the years, that not hopefully, but may change, may decrease. But I think my first psychiatrist back in 2014 said something to me, which was, if you had a heart condition, if you had diabetes, you would take that medication without even thinking about it. And I think there is still not a misconception, but there still is a slight, oh, I'll be better. This isn't really an illness. This is, this is something that that word should be able to deal with. So with medication, a good practitioner, psychiatrist, doctor will, I think the word's titrate, and it's a posh word for saying will modify the medication as you go along. So this is working a bit. Okay, let's match this in. I've been on 3 to 4 medications at a time. And I think it's that attitude. It's like, this is my life. And if it was something more physical, as it were, I don't think, I'm not saying this is me, but I think a lot of people do have this attitude of, I should be able to cope. Would you say that with a heart condition? Probably not.
No, that's very well said, because, I don't know why people's brains do this, but we're all just accustomed to feeling like, I can shake this off. I'll be fine. They kind of downplay those symptoms. But, if this is a constant condition and state that your brain is in, you've got to take it that seriously. And even though that kind of journey can seem daunting, just taking those first steps and kind of seeing those professionals is the way to go. And speaking of professionals, I'd love to bring you in, Dr. Nikila, because Katie mentioned there that something called TMS worked for her. Can you explain what that is and how it works?
Thank you. So transcranial magnetic stimulation, which is also referred as TMS or RTMS, is actually a non-invasive and safe treatment involving magnetic pulses delivering to underperforming brain. And it has minimal side effects. So TMS actually jumpstarts the brain, so brain can start working properly. In depression, brain signaling is poor, so TMS improves signaling. Whilst in anxiety and obsessive-compulsive disorder, brain signaling is excessive, so TMS reduces signaling. And TMS works at the root cause of the problem, and therefore patients improve very quickly. It re-establishes connections in the neural pathway and also corrects chemical imbalance. And we are doing this treatment since 2018 at Tranquil TMS with a great success.
I mean, that's quite a while. With all of this great success, then you say that you've had, how widespread is this? Because when this came across my desk to speak to you guys, I'd not heard of TMS. I'm sure a lot of listeners haven't either. But is this something that's kind of available everywhere? Is this becoming a more common sight across the UK?
It is now becoming more and more available. When I started back in 2018, my center was the first clinic in the whole of Northwest. But now slowly it is becoming available in the country.
But wow, the first clinic in the Northwest, you say? What then kind of inspired you to set that up? Because if this is a kind of treatment that, wasn't that popular, how did you what's the story behind you kind of setting up a clinic that does it?
So we wanted to try and give people different options of treatment for anxiety, depression, and OCD. As you know, medications are good, but they're not always cure for all these conditions. So we realized how effective our TMS is, and there weren't any services in the Northwest to provide TMS. Therefore, we decided to open the clinic and deliver TMS in 2018.
Katie, kind of bringing it back round to you, this treatment, why do you think you hadn't heard of it sooner, I suppose? Like, how did it kind of come into your life as something that, that you found out about and then you called Dr. Nikila here?
It's not available locally here on the NHS or anything. And I think, well, with my psychiatrist, probably don't need to say this for people who have sort of more, not severe mental health issues, but ongoing, should I say. Work, etc., is quite difficult. So finances are quite difficult. But when my psychiatrist and I looked at, he'd had a few patients who'd already had the treatment with great success. So it was just a case of the other treatments didn't seem appropriate for me. And as I said before, the length of waiting time. One thing to say, like Nikila said earlier, non-invasive, I cannot stress that enough. I mean, it literally feels like tiny little tapping on the side of your head. And there's one, as Nikila said, for depression and one spot for anxiety. Now, with bipolar, both are a problem, and that's why the ups and downs occur. So I actually had both sides, but not everybody would. And it got to the point after a few days and my nerves settling where I could literally have the treatment and drive home to Sheffield, which, all sorts of other ones like ECT and the MDMA trials. And I never remember the name, but there's a trial with the active component of what we call magic mushrooms. And all of those have quite drastic side effects, and you need to be sort of out of regular life for long periods of time. And when I have top-ups now, which I want to organise more regularly because I've sometimes left it a bit long. But when I have top-ups now and again, you don't have to have them. But when I do, I'll go one day and the next day I'll be following my normal routine, which is incredible, really. I mean, it's even easier than taking medication. Sometimes it takes 3 weeks or more for your body to regulate. It might be appetite, nausea, dizziness. It can be all sorts of, as you probably know, all sorts of side effects.
Yeah, no, we always hear about the side effects from different medication, and that doesn't mean that they're not worth taking. Of course, if it's not for you, then always see your doctor about getting a different kind of medication.
Oh, absolutely, yeah.
It's remarkable to me that there's a treatment like this that is not invasive, and you say, Dr. Nikila, doesn't have that many side effects, and also yourself, Katie, have said that. I probably should have asked this earlier, but who is this treatment for? Is it somebody who's just starting on their kind of mental health journey if they're feeling like anxiety or depression? Is it for someone like Katie who's tried a number of things and it's not worked? Yeah, what different conditions can this be helpful for?
So TMS is suitable for the majority of patients. So first group, what you said, people who do not want to take medication. So what we call as drug naive, but they are still suffering from anxiety, obsessive compulsive disorder and depression. So that is one group. Second group is like something what Katie has gone through, that they have tried numerous amount of medication, nothing has worked or minimally worked. And then the third group, where patients are taking medication but are having significant side effects such as feeling numb, drowsiness, metabolic syndrome, weight gain, and so on. So, and also if you look at the age group, at Tranquil, we treat patients from the age of 16, and we have treated loads of patients who are above the age of 70, oldest being 94 years of age. And in terms of clinical pathology, people who are suffering from all the types of depression, including bipolar depression, depression associated with ADHD or autism, obsessive compulsive disorder, anxiety disorders, including panic disorders. So the group is really wide and broad. The contraindications, if you look at it, it's mainly metal in head and neck and poorly controlled epilepsy. most of the other conditions you can treat.
Interesting. And from your experience, Dr. Nikila, of course, I can probably guess your answer to this, but similar to medications that treat this stuff, I imagine this is something that will not work for everyone, but will work for some people, yes?
Yes, that is right. Because it's at the end of the day, it's a medical treatment. So it's not going to work for everyone, just like any other treatment in medicine. But success rate of this treatment is quite high. Like in our clinic, when we did the study, the last our study showed the success rate was 66 to 76%. It's almost at par with international research. So it's a high success rate compared to antidepressants medication. But still, that means there's some group of patients may not improve.
No, and I think that's important. Basically, what I'm trying to get at is that, yes, there are minimal side effects, but there is no like miracle cure, so to speak. And that it's great that, of course, all of these medications exist. It's fantastic that this kind of non-invasive therapy exists, but it's about trying stuff until it works. And as frustrating as that is, of course, you wish it would just work the first time, right?
Yes.
It is a journey that people have to go on if they're to improve their mental health and ultimately improve their lives. So kind of final question for the both of you. Dr. Nikila, I'd love you to start. What does the future look like for this kind of treatment?
So the future, I feel what I want to see is that TMS is accessible to everyone and everywhere in the country. And to be honest with you, worldwide. Because it's such a safe and non-invasive treatment with hardly any side effects that rather than exposing with other side effects of medication, I think this should be the first line of treatment, ideally in ideal world for everyone. But at the same time, I do not want listeners to stop medication because and without any medical guidance, because that's not ideal. Everybody's journey is different. Everybody's condition is different, and medication still has place in the psychiatry.
Well said. And Katie, what does the future look like for you?
Very much brighter than it did 10 years ago. I will still be in contact with Tranquil TMS for top-up treatments because what we're looking at now is if regular top-ups, say once every 3 or 4 months, can really kind of lead to a real stability. Because although I'm very stable now, I guess it's like when you have a physio and you have a bad back and you go and it gets a lot better, but then you maybe just need to keep it going. So hopefully I'll keep working. I'll stay with my partner, and I'll lead a life which incorporates all the different things that I enjoy doing.
Fantastic. Well, thank you very much for joining me today on the show. We're running out of time, but if people want to find out more about this kind of treatment, where can they go for more information?
So I think I would direct the listeners to go to our website, that is www.tranquiltms.co.uk. There are lots of testimonials, real life patients' videos, and a lot of reading material. The other website I would say is National Institute of Clinical Excellence website. And there are lots of randomized controlled trials and meta-analysis in this field of TMS. And those are the sites listeners should go on.
Fantastic. Well, thank you very much to you both. Of course, the kind of main takeaway that we hope that you get from this is to speak to a doctor, speak to somebody if you're struggling, if you don't know who to turn to. We talk a lot about health on this podcast, and we always tell people, all the doctors end up telling us, Dr. Nikila, that the worst thing you can possibly do is to just Google your symptoms and see what comes up, right? Hear it from the experts such as yourself, to kind of talk about your journey, Katie, with not only Dr. Nikila here, but psychiatrists that you've seen previously as well. Yeah, further proves that if you get in touch with the right people, then good things can happen. Thank you very much. That's Katie Modoc and Dr. Nikila Deshpande joining us on the show here today. Thank you very much both for being here.
Thank you, Rory.
Thank you for having us. Thank you.
And thank you to you at home listeners for tuning into another episode of Modern Mindset in association with Share Radio. See you again soon for more.
Thank you for listening to Modern Mindset. To automatically receive the latest episodes, please subscribe. If you'd like to support the show, please share this episode with just one friend you think it could help. And if this episode helped you, please leave us a 5-star review. Modern Mindset, picking the brains of the world's leading minds to help you unlock yours.